Biomond larvae are applied under aseptic conditions. The following items are required to carry out a larvae wound dressing: a sterile kidney dish, a pair of scissors and forceps, Biomond gel strips to cover the edge of the wound, some standard sterile pads to cover the wound and keep the larvae moist, a piece of fine meshed Biomond net which prevents larvae escaping from the wound, sterile packed aseptic Biomond larvae, and sterile ringer solution or saline solution used to keep the larvae moist inside the wound, which is of utmost importance, as well as gauze bandages and medical adhesive tape to secure the wound dressing. Adhering to hygiene guidelines, Biomond gel strips are removed from the packaging and stuck onto the skin as close to the edge of the wound as possible. Then the protective sheet is removed. The skin-friendly gel strips restrict larvae activity and their secretions into the surrounding wound site, protect the wound edge skin, and serve as double-sided adhesive tape to hold the net in place. After the net has been cut into shape, a small amount of sterile saline solution is used to keep larvae suspended, and the required number of larvae is poured onto the net. The underlying pad absorbs the fluid, and the net containing the larvae is turned larvae side down and then adhered to the gel strips. To be on the safe side, the net is additionally secured to the skin using breathable medical tape. Now the larvae are securely confined in an airy cage. Finally, sterile pads are moistened, applied to the wound, and held in place with a gauze bandage. What has to be kept in mind while applying the bandage is that the dressing must remain air permeable. If a larvae wound dressing is allowed to dry out, the larvae will die. The larvae wound dressing has to be kept moist at all times and, if required, should be moistened 2 to 3 times a day using saline solution.